Good day everyone. In this video, we will be presenting on Ascaris Lumbricoides, one of the most widespread parasitic infection in humans. We will briefly cover its key features, life cycle, and how it causes disease. So feel free to pause the video anytime for more details on the slide. First, I'd like to acknowledge our team members ALISSYA, NAJAA, SYAFIAH, and FARZANA HANI. Ascaris Lumbricoides is the largest and most common intestinal roundworm infecting humans, with female reaching up to 35 cm and male up to 30 cm. Globally, it infects an estimated 807 million to 1.2 billion people, especially in areas with poor sanitizations, and can significantly affect children's growth and cognitive development. The life cycle starts when the adult worm in the small intestine produces around 200,000 eggs daily, which are possessed in feces. The egg can survive in soil for up to 10 years. Infections occur when the people ingest egg from contaminated soil, food, or water. The larva hatch into the small intestine, migrate through the liver and lungs, and return to the small intestine to mature, completing the cycle in about 8 to 10 weeks. Transmission is via the fecal-oral routes, with risk factors including poor sanitizations, use of human feces as fertilizer, and inadequate hygiene. Children are particularly at risk due to their play habits. Pathogenesis occurs in two phases during larva migrations. Tissue damage and lung symptoms like Lofty syndrome can occur. In the small intestine, a heavy worm burden may cause malnutrition, vitamin deficiency, and even intestine obstructions, especially in children. Chronic infection can impair both physical and cognitive development, and while rarely fatal complications, can cause thousands of deaths annually.
So let's start with the epidemiology of related disease. Start with local prevalence. Rates among children ranging from 14.3% up to 43.9%, with school age most affected. Globally, Ascaris lumbricoides is one of the most widespread human parasitic infection, affecting about 732 million people, especially in Southern Asia, Eastern Africa, and South America. Moving on to transmission and risk factor. Ascaris is spread primarily through oral fecal route, by ingestion of embryonated eggs, hand-to-mouth contact, and poor sanitation practice. For risk factor, it concludes on poor sanitation and hygiene practice, warm and humid climates, and heat, especially for children under 14 years old. Finally, the public health impact is significant. Infected children may suffer from malnutrition, stunted growth, and reduced cognitive function. Economically, this leads to increased healthcare costs and decreased productivity. Effective control relies on mass drug administration and improving sanitation and hygiene to break the cycle of infection.
Next is for specimen collecting and processing. For Ascaris lumbricoides, we normally, for sample collection, we do the patient stool sample. And then for processing, it involves a few steps, which is portioning and preservation, labeling and transport, microscopy and concentration, staining for the eggs, and also examining directly under microscope for whole worms. Next, moving on for the advanced diagnostic techniques. The first one is the real-time quantitative PCR, whereby this detects measure Ascaris eggs by using the ITS1 region of the DNA. Next is the loop-mediated isothermal amplification, where it is fast and highly specific DNA amplification method that works in constant temperature, which is 63 degrees Celsius for under 1 hour. And lastly is the copro antigen detection, where this method involves detecting Ascaris-specific antigens such as ABA1 copro antigen in the stool sample.
So next is the conventional method. Firstly, we have microscopy, which is detecting eggs in the feces using microscope. The technique is direct smear or Cato-Cats method. Next, clinical observation, which is observe the symptom such as abdominal pain and malnutrition and cough, but it has limitation, which is symptom is not specific. And lastly, X-ray or imaging. This is occasionally used if intestinal blockage is suspected, but it's not routine and only used in severe cases. Next, the difference between conventional versus advanced method is the sensitivity and specificity. For conventional method is moderate to low rather than advanced method, which is high. The cost using for conventional method is low, while in advanced it has high usage of cost. In the equipment needed, conventional method is basic, which is such as microscope, while in advanced method it has advanced lab, which is PCR machine and others. Ease of use in conventional method is simpler rather than advanced method. or require training. And time to result for conventional method is quick, which is minute to hour, while in advanced method it's slower, which is hours to days. Lastly, conclusion, Ascaris Lumbricoides is a common parasitic worm that causes significant health problems, especially in children from areas with poor sanitation. It spread through contaminated soil and can lead to malnutrition, growth delay, and other serious complications. While advanced diagnostic tools like qPCR and LAMP offer improved detection, prevention through hygiene, sanitation, and deworming remains the key to controlling its impact. So this is the reference that we use, and thank you for watching.